Many people put off getting their teeth replaced, but they don't realize there's many options available to them. The important reasons to replace missing teeth: for function, for chewing, cosmetics, and also the maintenance of the remaining dentition. To leave spaces in someone's mouth, while some people may function, you've lost the support system and it can lead to further problems, a cascade of problems. Most typically is the cracking of adjacent teeth as they become overloaded. So it's very, very important to replace teeth when possible, especially with something like a dental implant, which is a more permanent fixture, but the closest thing to replacing your natural tooth, because it's going to actually preserve adjacent teeth by spreading out those forces. When you come here to have a full arch therapy or treatment plan for dental implants, everything is patient focused. We develop a treatment plan that is specific to you, to your anatomy, to your anxieties, and we talk about this with you and we come up with a plan together. When you come back for the surgery, we have a team, again, who's focused on your care and you alone. It's your day. We're all here for you. That includes the staff, the lab technician, and the restorative dentist, and myself, who performs the surgical portion of the procedure. We also are able to provide intravenous sedation, so the day of surgery, you're going to be really comfortable. You're not going to have pain, and we're going to take good care of you. If you are looking into dental implants, if you want more information about full arch specifically, call us, come in for a consultation. This is what we do. We're the experts. We're happy to guide you. We think we're the best place to have this done, to have a successful outcome and a positive patient experience.